My name is Christina. I'm doing a head-to-toe physical exam for my Class 517 Advanced Health Assessment. Hi, my name is Christina and I'm a nurse practitioner. What's your name?
Hannah.
Hi, Hannah. I'm going to be doing a head-to-toe physical assessment.
Okay.
Okay, so I'm going to start with Hannah's head. I'm palpating Hannah's head. I'm noting that there's no masses. Her head is normal cephalic. It's atraumatic. Her hair distribution is normal throughout. Next, I'm going to observe Hannah's eyes. So when I'm looking at Hannah's eyes, I'm noticing that they're symmetrical. And I'm going to look at your eyelids. Close your eyes for me. Good. Open. So just upon inspection, I can see that Hannah's eyelids do not demonstrate any exudate, any arrhythmia, any edema. I can see that her sclera is white, it's moist. I can clearly see her iris. Next, I'm going to do some tests on Hannah's vision and pupils. So Hannah, what I want you to do is to hold your head straight, and then without turning your head, I want you to follow my finger with your eyes. Okay? I'm testing Hannah's extraocular movement. She has no trouble following my finger with her gaze. Next, I'm going to look at Hannah's pupil reaction to light. So Hannah, you can just stare straight ahead for me, and I'm just going to shine this light near your eye. Good. Excellent. Hannah's pupils are brisk, they're equal and round and reactive to light. Hannah, the next thing I want you to do is focus on an object that's very far in the distance. Okay? And then what I want you to do is focus right here on my finger. Excellent. Hannah's demonstrating perfect convergence, which means that her pupils are a little bit more dilated when focusing on an object further away, and then they constrict when she shifts her gaze to an object that's near. So next I'm going to observe Hannah's ears. Alright, so I'll start here on the side. I'm just observing the external structure of the ears. I'm noting that her pinnae is normal. When I'm palpating it, my patient is not wincing or showing any signs of discomfort. When I pinch here, just very gently. On the tragus, do you have any tenderness?
No.
That is a normal finding, and I'll do the same on the other side. I don't see any changes in her skin. I don't see any arrhythmia, no edema, and no pain or tenderness. Next, I'm going to take a look inside Hannah's ears. Good. I'm looking at her tympanic membrane. It's a pearly gray color bilaterally. There's no bulging. The inner canals of her ears don't show any arrhythmia, edema, and things of that nature. To back up, when I was assessing Hannah's eyes, if I was using my ophthalmoscope, I would be looking at her discs. And what I expect to see are very sharp, well-defined disc margins. I expect the disc to have a pinkish or yellow kind of creamy color of that nature, and that would be a normal finding for part of the eye exam. So we just did ears, so now we'll do her nose. So I'm just going to first just inspect her nose. Her nose is symmetrical. The skin on her nose is normal for ethnicity, matches the rest of the skin tone on her face. I'm going to take a look inside your nose, Hannah. So if you can let me tilt your head back. Excellent. Excellent. So I'm noticing that the septum is midline. The turbinates on both sides are dark pink color. There's no arrhythmia, there's no exudate, there's no edema anywhere in her nose. Next, I'm going to assess the patency of each nostril. Hannah blew her nose before this exam, so I know there's not going to be any gunk in there obstructing her ability to breathe. So I'm just going to occlude this nostril. Allow her to breathe in a couple of times. Alright, and Hannah's nostrils are patent bilaterally. Next, I want to observe her mouth and throat. So I'll start on the outside, looking at her lips. They're symmetrical, they're pink, they're moist, there's no cracks in the corners. Hannah, can you open your mouth for me? Good. And I'll get my pen light out here again. Good. So at this time, I'm noticing that the buccal mucosa is very pink. It's moist. I don't see any lesions. I don't see any edema. I don't see any arrhythmia. I can see the Stevens duct near the parotid on either side, and there's plenty of saliva, which is normal finding. Her teeth appear to be in very good health. The enamel, there's no evidence of any enamel erosion. They're white, they have good dentition, they're straight, things of that nature. There's no abnormal odors of Hannah's breath, which I also appreciate. Next, I'm going to ask you to stick out your tongue, Hannah. I'm going to use my tongue blade here, and I'll have you say ah, okay? Stick out your tongue for me. Open your mouth real wide. Good. Here I'm observing Hannah's uvula. It rises symmetrically. The posterior pharynx and part of her mouth, I don't appreciate any cobblestone, arrhythmia, edema, or exudate. Next, I want to just look at Hannah's neck. So when I'm looking at Hannah's neck, I'm noticing her skin first. I don't see any hyperpigmentation or discoloration of the skin around her neck. I'm going to just gently feel around her neck, noting for any masses or any dents, any sign of abnormality, and of course any pain or tenderness. To palpate her thyroid, I'm going to come back here. I'm going to find that cartilage, and then I'm going to have Hannah swallow. Good. Again. Good. And what I'm noting is on my finger pads is that there's a symmetric elevation each time she swallows. There's no dissymmetry or asymmetry. And that would indicate a thyroid problem like goiter or nodules. I'm going to palpate her sinuses next. So I'm going to just take my thumbs and put it near your eyebrows, Miss Hannah. And I'm kind of pressing a little upward. Good. And same thing. Is there any tenderness?
No.
Okay. So there's no pain or tenderness upon palpating Hannah's maxillary or frontal sinuses. Okay. So next we're going to do her carotid pulse. Her carotid pulse here will be palpated in her neck. Okay, I'm noting that the rhythm is regular. The rate is not particularly fast or slow. It's strong and equal bilaterally. We chart that as 2+ carotid pulses. I'm going to now move on to her range of motion exercises. We'll start with her shoulders. Hannah, I want to assess for adduction of her shoulders. So Hannah, raise your arms up above your head. Excellent. And you can put your arms down. For abduction, we'll have you cross your shoulders. Good. And then for external rotation, put your arms out like this. We're going to go like this and rotate out and then rotate in. Excellent. Any pain or discomfort?
No.
Fabulous. Moving on to her elbows, we're going to have you extend your elbows to the side of the bed, or there's fine. Good. And then I want you to flex your elbows. Keep your elbows in. Great. And put your arms out in front of you. Okay. And turn your arms up. And back. So this would be a pronation and supination. All right. Now for her wrists, I'm going to have you leave your arms where you're at. I want you to flex, extend. Great. And then for your hands, we're going to have you make a fist. Good. And extend. Good. Can you spread your fingers? Abduct your fingers. Abduct your fingers. Good. Assessing for grip strength. Squeeze my hands tight. Good. So her grip strength is strong and equal bilaterally. We would chart that as a 5+ on her grip strength. Her joints don't show any evidence of deformity. The range of motion is performed without any pain or difficulty. It is smooth and symmetric. I'm noticing the whole time I'm doing this exam, her skin on her arms and her hands, it's dry and tacked, it's warm. I can see that her nail beds are pink. She's got excellent capillary refill on both sides. There's no evidence of clubbing. I also at this time assess her radial pulse. Her radial pulse is strong and equal bilaterally. We would chart that as a 2+ radial pulse. Same thing for brachial pulse. Her brachial pulse is strong and equal bilaterally, 2+. Okay. So now we're done with our range of motion exercises. I would move to her respiratory assessment, where I just start by inspecting her chest. So I'm going to unbutton the top of your gown a little bit here. Okay. General inspection reveals that her skin is dry and tacked. There's no lesions, there's no observable masses, arrhythmia, edema, bruising, anything like that. When I place my hands on her chest, I can feel that there's a equal rise and fall to her chest on both sides. And then next I'm going to auscultate. I'll button this one here. And Hannah, if you don't mind spinning to the side of the bed for me. Excellent. Okay. All right. So before I begin auscultating, I did just want to take a time to palpate. I'm noting that I can't palpate any crepitus. I would feel like almost a crackling sensation, which I don't feel here if she were to have some. Next I'm going to auscultate. We'll listen to the front first. And you take some comfortable but deep breaths in and out. I'm comparing side to side. This helps me note if there's any changes from one lung to the next. Okay, thank you. Okay, next, Hannah, what I'm going to do is listen to the sides, laterally to your lungs. If you can put your hands above your head, you can rest your hands on your head if they get tired. Again, doing the same process at 4 different points, comparing side to side. I'm noting at this time that so far I don't hear any wheezing. I don't hear any crackles. There's no adventitious breath sounds. Okay, I'm moving my way a little further down. Excellent. Okay, you can rest your hands down again. We'll take a listen to the back here. Okay, thank you, Hannah. You can climb back into bed. There we go. Hannah's respiratory exam was normal. No adventitious breath sounds, no crackles, no wheezes. Clear upon auscultation. All right, Hannah, I'm going to lay you flat. Hang on. Are you comfortable?
Yeah.
Okay, great. So, to do our cardiac exam, hold down. Okay. So I've already done a physical inspection of Hannah's chest prior to the respiratory assessment. I'm going to listen to her apical, aortic, pulmonic, tricuspid, mitral, and apical pulses with both the bell, or the diaphragm and the bell of my stethoscope. You can just breathe normal. Again with the bell. Her S1, her S2 is regular and clear. I don't hear any murmurs, gallops, clicks, anything like that. I'm going to take my hands, I'm going to palpate on the left midclavicular line right here, right where her apical pulse is. It's a very gentle pulse. It's not throbbing or bounding, which is normal. I'm going to assess and compare it with the carotid. They're equal and they're rhythmical. Very good. I don't feel any heaves, any lifts. Just palpating for any abnormalities. No thrills, any abnormalities palpated in her chest. Okay, I'll cover you back up. Next we'll do an abdominal exam, keeping your patient covered. Okay, great, thank you. So I'll start here on the right side. Just observing Hannah's stomach. Again, noting her skin is without any petechiae, bruising. Her abdomen appears flat. There's no edema. There's no visible masses that I can discern at this time. And then I'll begin auscultating her bowel sounds. We'll auscultate all 4 quadrants. She has normal active bowel sounds in all 4 quadrants. Next, I'll begin with percussing some of the organs. So I'll first start with percussing for the liver. I start up higher here on the right midclavicular line. And what I'm hearing and listening for is when it goes from a dull sound to tympany. And that helps me determine the edge of the liver. And I'll repeat the process going back up. Okay, so based upon percussing, I can determine that Hannah's liver is about right here. It's about 1 centimeter below her rib cage, which is normal. I'm also going to percuss her spleen. I can hear dullness over where her spleen is. Her spleen does not appear to be enlarged. And then I can percuss around in her stomach, and in general you'll hear more tympany over the air-filled organs like your stomach and intestines, and then there's a more dullness sound upon percussing the spleen and liver. For palpating, you want to start with kind of a gentle palpation throughout. You're noticing that your patient's not in pain or wincing or uncomfortable at all. Okay, and then for deeper palpation, you're going to ask your patient to take deep breaths in and out. And I'm palpating for the edge of that liver. Good. Next, I'll palpate for the spleen and kidneys. Deep breaths in and out for me. Okay. Hand under the back for the kidneys. Ticklish. One more kidney on this side. Okay. I cannot palpate the spleen or kidneys, which is a normal finding. Last but not least, we're going to examine Hannah's legs. I'll sit you back up, Hannah, so you can see. Okay. So pulling back the covers here, just inspecting the legs at first, I'm noticing the color of the skin. The skin is normal and appropriate for ethnicity. I don't see any redness. I'm noticing that it's completely intact. There's no wounds. There's no in general edema. When I feel her skin is warm, it's dry. I'm moving to her feet and I'm assessing her dorsalis pedal pulses. They're strong and equal bilaterally. We would chart that as a 2+ on her pedal pulses. We'll do the same assessment for the posterior tibialis. Good. Again, those are strong and equal bilaterally. We would chart that as a 2+ for posterior tibialis pulses. I'm also noticing the colors of her nail bed and her toes. They're pink, and I'm checking for capillary refill, which is excellent. It's less than a second for the color to return to each of her toes. Okay. So in summary, we did a full head to toe physical exam. We started with the patient's head. Well, we started with an introduction, started with the patient's head. We observed no abnormal findings in her head, eyes, ears, nose, throat. She had clear breath sounds in all areas. She had a normal S1, S2 sound heard upon auscultating her heart tones in all areas, a regular rate and rhythm. She had excellent and equal range of motion in her shoulders, elbows, wrists, and hands. She had good, strong, and equal pulses, radial and brachial and carotid pulses. And then moving to her abdomen is a normal shape. It's not distended, it's flat, it's soft. Her liver is appropriate size. She has normal active bowel sounds. Her legs demonstrate, again, the skin is dry and intact. She's got excellent capillary refill in her toes and in her fingers, and excellent pulses, dorsalis pedis and pedal pulses. And that concludes my head to toe physical exam.